video demonstrates
Okay, so I'm just going to show few different techniques. Okay, can we start this video again? It's on that side. ILM is already peeled. Yeah. So this video is basically to show you how to pick up. So just this is just a pinch and just hold, leave it. Don't try to pinch and then peel at the same time, because this once you pinch that there, so you will get a small edge of the ILM which can be hold again, and then try to peel it off. And then if you're planning to do an inverted flap, the one thing which I usually start doing now is don't peel off completely, then have a free flap which is difficult for you to keep it there. So I just keep the attachment to the macular hole intact and try to trim it so that it won't inadvertently come into the cutter completely. Once you have done that, then try to separate it from the edges of the hole, and then try to tuck it inside the macular hole. That will make sure that, and don't try to peel it off completely from the edge. Maybe you can leave one tag there so that it can stay there in position. So once you have done that, it's tries to stay in that position. So that's where I am trying to separate it from the edges, and then try to gently tuck it inside the macular hole. Then you can do an FGE, so it should not be an issue where the ILM comes into your cutter or a flute needle when you are trying to do a FGE. Next. Next. Yeah, so this is another thing which I wanted to highlight. So this is one of my fellows trying to do an ILM peel, and he was struggling hard to pick. So I was just trying, I was observing him from outside. So let's see what he does. So after some time he was not able to find, he stained it well, but then started getting a bleed there. So he was not sure what he was dealing with. Then I had to go and then tell him, so that's not, so unless there's one thing which my teachers have told me, you can, if you can see, you can do it. So you need to see. So you need to increase your magnification, use a different viewing system if it's needed, maybe a contact lens system. And this case specifically has an epiretinal membrane also on top of it. Makes it little difficult for you to peel off the ILM straight away, because sometimes it can get torn because the ERM is trying to keep it intact in position. So you may have to deal with the epiretinal membrane also at the same time. So the other option is where you can peel off the ERM and then restain again and do it. So you go beyond the epiretinal membrane, hold the ILM and try to peel. So you will get both epiretinal membrane and an ILM together. So that's an advantage if you have a little wide angle viewing system. Sometimes with a contact lens system where it might be a little difficult for you to visualize that. Next.
This video demonstrates the ILM free flap technique for macular hole closure.
So this is one of
the conventional vitrectomy and removal of ILM around the macular hole.
Yeah. So this is what happens when you removed the whole ILM and then you are trying to put it in. So that's where the difficulty comes in, and especially when you do an FGE like this, and the flap might just come into your port and then comes off. So if you leave that tag there, that's an advantage. That's the reason why I wanted to show you this. Next. Yeah, that's it. Yeah. So those are the few tips when you are doing an ILM peel. So
well, inverted flap, the concept of tucking in is a little dicey at times. So if one leaves just a little tag attached, and let's just lets it fall on place, it works pretty good. And in post-operative imaging, you can actually, after 1 week, see the flap very nicely there with the hole closed. When you're tucking inverted flap, then there can be a little damage to the RP. That is what is my apprehension on it.
So the thing which we do is never go with an open forceps there. Close the open forceps and try to push it from the sides. Don't have to go inside in the center and try to push it down. Don't have to do that. So we will be able to push that ILM inside. So if you leave a little larger flap, if you keep a smaller flap, it becomes difficult. You have to push directly there. Then it causes a damage more to the RPE there.
With this technique having become popular, the old concept of trying to drain a little away from the edge has almost finished. We just drain at the
so always
disc.
drain from the disc. Don't try to drain closer to the hole.
I don't use any instrument because I'm always afraid of disturbance to the RPE, as you said. I will leave that flap there itself, and still it leads to type 1 closure in a lot of these patients. Tucking does not offer additional advantage. Whatever I have done, around 12, 13 of them, even in patients who have RD with macular hole, reg RD, peripheral break with macular hole. So just leave that flap there, around 1.5 size more than the size of the hole. Just leave it there. Don't peel it. So
we recently published on this, and if you have slightly larger flap and you look at the retinal surface of the flap and the vitreal surface of the flap, and you do an EM study on that, you will find that the retinal surface and vitreal surface virtually correspond with each other. So they actually stick to each other like a Velcro. So if you have two flaps coming over each other on the macula, and so over the macular hole, they cover each other like a Velcro, and now this becomes a separate compartment. Since it becomes a separate compartment, the RP actually works better to suck the fluid off. And that compartment, even if your vitreous has fluid, of course you put in gas, but this makes it more dry than you can even imagine. That's the theory. So we have seen it work in some cases.
Quite possible.
The most theory is that it acts like a substrate, like a basement membrane for growth of any tissue. That is the actual theory of ILM flap inversion, which has been in one of the recent publications I saw. And secondly, ILM is not just in electron micrographic studies have shown, ILM is just not a surface thing. Like what the concept what Ajay said, in fact the Mueller cells have deeper ramifications. So it has a kind of a, through partial thickness of the retina, there is an effect of the ILM and of the peel. That's what it is. The Mueller cells have some deeper ramifications.
So that's what actually makes that once they're attached to each other, there is a centripetal force, and the centripetal force may be actually helpful in the hole closing.
Thanks, Raj.